I'm Anthony Cacchiotti, and today I'll be talking about a very interesting disease called restless leg syndrome. The pathophysiology and etiology of restless leg syndrome is generally unknown. Recent data suggests that restless leg syndrome can be caused by iron deficiency in the substantia nigra in the CNS. In restless leg syndrome, studies have found a dysfunction of the dopaminergic system and iron stores in specific regions in the brain are diminished. Studies demonstrate a strong relationship between genetic predisposition and early onset restless leg syndrome, of which more than 60% reveal a positive familial history. This disease is extremely common in the first trimester of pregnancy. It may be due to the vitamin D deficiency, preeclampsia, a strong family history, low serum iron and ferritin level, and high levels of estrogen. Patients often experience an unpleasant aching which causes the irresistible urge to move the legs. Terms that patients use to describe the symptoms include crawling, creeping, pulling, itching, drawing, or stretching. These are all localized to deep structures rather than the surface of the skin. This feeling is most common at night when your body is at rest and is temporarily relieved by moving the legs. Common strategies that are recommended to patients include abstinence from alcohol and caffeinated drinks, proper sleep hygiene, and pneumatic compression devices. A few clinical trials have demonstrated a positive benefit by completing moderate exercise. In general, as activity increases, the patient's symptoms should decrease as well. There are two first-line treatments that patients with life-altering restless leg syndrome might receive. The first are the non-ergo-derived dopaminergic agents. These include pramipexole and ropinirole. They work as agonists at both D2 and D3 dopamine receptors. And some common side effects of this medication include sleepiness, nausea, and insomnia. This medication should be taken 1 hour before bedtime. The second first-line treatment for restless leg syndrome are calcium channel alpha 2 delta agonists. These include gabapentin and pregabalin. The exact mechanism of these drugs are unknown in the treatment of restless leg syndrome. Some common side effects include weight gain, dizziness, and gait instability. Patients with neuropathic pain disorders are often put on gabapentin or pregabalin as opposed to the dopamine agonists. Pregabalin is a controlled substance, and gabapentin has recently showed addictive properties and may be a controlled substance in the future. These addictive properties limit the use in restless leg syndrome. Pregabalin has shown to work better for restless leg syndrome but is more expensive than gabapentin. Therefore, gabapentin is more commonly used. In more severe cases of restless leg syndrome, both the calcium channel alpha 2 delta agonists and the dopaminergic agents may be used at the same time. Polysomnograms are used to measure movements and records the time the patient can stay still and the limb movements during 1 hour. This is used to quantify the severity of restless leg syndrome, to follow up on the patient's course of disease, and to monitor treatment response. That concludes my presentation. Thank you for listening.